New update in weight loss medicine. A higher dose of Wegovy 7.2 milligram was just FDA approved, with clinical trials showing over 20% weight loss. Wegovy 7.2 milligram isn't just a higher dose. This could actually change how we treat obesity in a very real way. But it's also important to understand who high dose Wegovy is for and who it isn't for, and also to be aware of a mysterious side effect that most people may not see coming with this higher dose. Hi, I'm Dr. Bazgha Khalid. I'm a board certified internal medicine and obesity medicine specialist. And before I talk about high dose Wegovy 7.2 milligram, let's talk about the real problem. Most people trying to lose weight are doing something like eating less, trying to move more, and maybe trying different diets. And for a short time, it works. But then something happens. Hunger increases, energy drops, weight loss slows down or stops. And people start blaming themselves. But excess weight is not a willpower problem, it's a biology problem. Your body actively defends its weight, and that's exactly where medications like Wegovy come in. So, what is Wegovy? Wegovy is the brand name for semaglutide. It's a medication that mimics a natural hormone called GLP-1 or glucagon like peptide 1. GLP-1 is released after we eat, and it tells our body a few important things like you're full, slow down digestion, and reduce appetite. It also helps regulate blood sugar. So instead of constantly fighting hunger, people often feel satisfied with less food. That's a completely different experience from traditional dieting. Think of your brain as having a volume knob for hunger. In many people with obesity, that knob is turned up too high. Wegovy helps turn that volume down. So instead of constantly thinking about food, you feel full sooner, less hungry between meals, and more in control. And that's why Wegovy works. Now let's talk about what the clinical trials show on high dose Wegovy 7.2 milligram. In earlier trials with the standard doses of Wegovy 2.4 milligram, people lost about 15% of their body weight on average, which was already a huge breakthrough. But researchers wanted to know what happens if we go higher on the dose. The Step Up Phase 3 clinical trial evaluated the efficacy and safety of a higher investigational dose of Wegovy 7.2 milligram compared to the standard maintenance dose of 2.4 milligram in adults with overweight or obesity. The final 72 weeks results showed that Wegovy 7.2 milligram with 20.7% mean weight loss versus Wegovy 2.4 milligram with 17.5% mean weight loss versus placebo with 2.4% mean weight loss. A significant portion of the 7.2 milligram Wegovy group reached impressive weight loss. Around 50% of study participants had around 20% body weight loss, while 31% of the study participants reached around 25% body weight loss. This means nearly 1 in 3 people in Wegovy 7.2 milligram group lost around 25% of their body weight. So higher dose 7.2 milligram Wegovy leads to a significant weight loss, making this comparable to Zepbound and bariatric surgery results. This is huge. But here's where it gets interesting, because weight loss is only part of the story. Patients on Wegovy often experience improvement in their blood pressure, blood sugar, insulin resistance, cholesterol levels, sleep apnea, and inflammation. Many people also report better energy, less joint pain, and improved mobility. So, this isn't just about weight, it's about metabolic health. Now, let's talk about the big question. What does this new 7.2 milligram dose Wegovy approval actually mean? It means that for some patients, we now have the option to go beyond the current standardized dose of 2.4 milligram. This higher dose could help people who plateau on lower doses of 2.4 milligram, people with more severe obesity, and people who need a stronger metabolic response. But this is important. More is not always better for everyone. Higher doses can also mean more side effects, slower titration, and closer monitoring. This is something that needs to be individualized. Like all GLP-1 medications, Wegovy can cause side effects. The most common side effects are GI side effects like nausea, vomiting, diarrhea, constipation, and acid reflux. These side effects usually happen when starting the medication and when increasing the dose of the medication. And side effects often improve over time. But with higher doses like 7.2 milligram of Wegovy, these side effects may become more noticeable for some people. A total of 3.3% of patients in the Wegovy 7.2 milligram cohort discontinue treatment because of GI side effects, compared to 2% in the semaglutide 2.4 milligram cohort and 0% in the placebo cohort. Let's talk about a side effect that is making news. The trials show dose-dependent significant increase in sensory side effect, also called dysesthesia. This is abnormal skin sensation like tingling, burning, or extreme sensitivity to touch, appearing in 22.9% of patients on the 7.2 milligram dose compared to just 6% on the standard 2.4 milligram Wegovy dose. This shows that while the higher dose can lead to more weight loss, it also increases the chances of nerve-related symptoms in some patients, about 1 in 4. Most of these symptoms are mild and tend to settle over time, but they're important to consider when comparing the high dose to the standard dose. Let me ask you something. Are you currently on Wegovy or tried Wegovy in the past? Did you notice any abnormal skin side effects with Wegovy? Let's talk about who will benefit the most from high dose Wegovy 7.2 milligram. This higher dose may not be for everyone, but it may especially be helpful for patients with higher BMI, patients who plateaued on current maintenance dose of 2.4 milligram of Wegovy, or patients with significant metabolic disease that need a higher dose. It's less about chasing numbers and more about improving health outcomes. Now let's talk about a very real issue: cost and availability of Wegovy 7.2 milligram. A higher dose once weekly injection is expected to launch in the US in April of 2026, following FDA approval on March 19, 2026. Regarding cost, I haven't seen any official announcement yet regarding cost of 7.2 milligram of Wegovy. However, Wegovy 2.4 milligram is currently available at $349 through NovoCare Pharmacy. So the cost of Wegovy 7.2 milligram will be around or maybe higher than that. We'll wait and see. Hopefully by the time I actually post this video, we'll have more clarity. It's unfortunate that most insurances still do not cover weight loss medications. Now, a lot of people hear about these new medications and think this is the easy way out, but that's not what it is. Wegovy and similar medications are treating a chronic disease. Obesity is just not about eating too much. It's about hormones, brain signaling, and metabolism. And medications like Wegovy help correct those signals. Here is the big picture reflection. We are entering a new era in obesity medicine. For decades, obesity was misunderstood. Now we are starting to treat it with same seriousness as other chronic health conditions. And higher dose options like Wegovy 7.2 milligram give us more tools to help patients succeed. But the goal is not just weight loss, it's better health, better quality of life, and freedom from chronic health conditions. So here's the real question. Is the new 7.2 milligram dose of Wegovy a breakthrough? For the right patient, it absolutely could be. But like everything in medicine, it's about the right treatment for the right person at the right time. In my next video, I'm going to talk about something that's getting even more attention right now: a new weight loss medication that may outperform everything we have discussed so far. Trust me, you don't want to miss that one. If you found this video helpful, subscribe and share it with a family member or a friend who would benefit from this conversation. Stay happy, healthy, and well. And I'll see you in the next video. Bye for now.